Good morning, good afternoon, folks. Welcome to the DLT Grant Program webinar. It's going to be my pleasure to introduce to you Doug Martin, your Management and Program Analyst for Rural Utilities, to get us started. Doug?
Thank you, Scott. Hello, and thanks for joining us today. We have a couple of presenters presenting the webinar today. Yours truly. My name is Doug Martin. I'm a Management and Program Analyst with Technical Assistance Branch. We'll also be joined by Ken Wiseman, who is also a Management and Program Analyst with Rust's Technical Assistance Branch, Policy and Outreach Division. Next slide, please. Quickly go over the agenda. So first, we're going to give a quick introduction to the DLT program, the Distance Learning and Telemedicine program. We'll go over some eligibility. We'll talk a little bit about completing an application. We'll talk a little bit about available resources. And then, as Scott mentioned, we'll leave about 10 to 15 minutes for some questions, to get some questions answered for you. All right, introduction to the DLT program. Just quickly on this slide, so the hierarchy for the program itself, the authority comes from the statute. The regulations inform us about how to implement the law or the statute. The NOFO, or the Notice of Funding Opportunity, that was issued on May 1st, provides guidance on this particular funding window. And then we've got that application guide that we've created for you to try to help you, assist you in doing your application. Next slide, please. Really important up front that we kind of level set with some definitions here. So distance learning, it is an interactive telecommunications link to an end user through the use of eligible equipment to provide educational programs, instruction, or information originating in one area, whether rural or not, to students and teachers who are located in rural areas. So the keys there: interactive, and to rural, students in rural areas, teachers and students in rural areas. Telemedicine is similar in concept. It's also an interactive telecommunications link to an end user through the use of eligible equipment, electronically linking medical professionals at separate sites in order to exchange healthcare information in audio, video, graphic, or other format for the purpose of providing improved healthcare services, primarily to residents of rural areas. All right, next slide. Just quickly, some facts about this year's funding round. So there is a total of $27 million for the program for fiscal year 2026. The award amounts range from a minimum of $50,000 all the way up to $750,000. We do anticipate that this is going to be highly competitive. We do expect to make around 40 awards for fiscal year 2026. The program itself, as always, open to nonprofits, for-profits, tribes, states, state and local governments, and units established by state and local governments. Still, the projects are still serving residents in rural areas with populations under 20,000. The scoring criteria are outlined in the notification of funding opportunity. They are rurality, economic need, and project benefits. We'll go into those a little bit more further in the webinar. Next slide, please. Let's talk about eligibility. Entity type. So it's a wide variety of entities that are eligible. Incorporated organizations, whether for-profit or not-profit, tribal organizations, as mentioned, state or local units of government. Also consortiums, we'll talk a little bit about that here in a second, are also eligible. The keys are for applicants. Applicants must operate a rural community facility or deliver distance learning or telemedicine to entities that operate a rural community facility or to residents of rural areas. So you have to be operating and delivering services to residents in rural areas. You need to provide written evidence of your legal capacity to contract with RUS in order to obtain the grant. You need to be able to implement the project, own the assets, and comply with all applicable program requirements. Next slide. All right, so consortia. A consortium is a combination of entities that come together for the purpose for a common purpose. And in this case, it would be for DLT financial assistance. A formal consortium has the legal ability to contract with the government in its own name. It can apply in the name of the formal consortium. An informal consortium is folks kind of getting together informally. Multiple entities, they're going to share the grant responsibilities and asset ownership. One entity will need to serve as the organization that's applying on behalf of the informal consortium. And each individual entity must meet the eligibility criteria and have the ability to contract with RUS for an informal consortium. Next slide. There is a matching contribution of at least 15% of the requested grant amount. And of course, it has to be used for eligible grant purposes. Let's talk a little bit about tribal. So if you are proposing service on or over tribal lands, and the applicant is non-tribal, a letter of consent is required from each tribal council that has jurisdiction over those tribal lands that you're proposing service over. If this gets the next level up is if you're proposing infrastructure, construction, or deployment on or over tribal lands. In that situation where you're proposing construction or deployment, you actually need a tribal resolution, and that's required from the tribal government with jurisdiction over the tribal lands. Important to keep in mind here, if you are proposing this and you're a non-tribal applicant and you don't get either the letter of consent or the tribal resolution, you could be determined to be ineligible for funding. So please bear that in mind. Next slide. All right, there are 5 categories basically of eligible grant purposes. Number 1 is acquiring and installing either through lease or purchase eligible equipment. If it's leased, the cost of the lease during the 3-year life of the award is eligible. Secondly, purchases of extended warranties, site licenses, and maintenance contracts are eligible grant purpose. Number 3, acquiring or developing instructional programming. So course curriculum, training videos, that sort of thing. That is a capital asset. So including the purchase of or lease of instructional course curriculum. Number 4, providing technical assistance and instruction for using eligible equipment. That's limited to 10% of the grant, so that's just assistance with actually using the eligible equipment. And the 5th category is purchasing and installing broadband facilities. And these are things like your fiber optic cables, your coax for cable, for DSL copper lines, and so forth. It's basically the applicant owned and used for providing distance learning or telemedicine services. In this situation for this award, that is limited to 20% of your requested grant amount. Okay, next slide. Some examples, not all exhaustive. There are more examples in the application guide, but here's some examples: computer hardware and software of eligible equipment, audio, visual equipment, monitors and other display devices, telemedical devices, broadband facilities if you own the broadband facilities, cybersecurity software that's directly related to the funded project, video conferencing platform licenses that are also directly related to the funded project. So it's not just that you can go out and buy a bunch of hardware and software. It needs to be for the purposes of the DLT program. So for each line item, basically that you're budgeting for this eligible equipment, it needs to be predominantly, and that's 50% or more usage, meeting the needs of the program, which is delivering distance learning or telemedicine. Okay, next slide. Some ineligible grant purposes. Your application preparation costs, salaries, wages, employee benefits, subscriptions, medical, educational services, your operating expenses or recurring expenses, including broadband connection fees. Any equipment that doesn't have, of course, telemedicine or distance learning as its essential function is ineligible. Also, we do get this question occasionally. So any costs that are incurred prior to us receiving your completed application are ineligible. Next slide. Building construction, renovation, or alteration are ineligible. Duplicate facilities, so again, your network facilities that are already providing adequate services are ineligible. Projects whose sole objective is to provide a link between sites at the same facility, ineligible, because again, we want to deliver services out to those rural residents. That's the purpose of the program. And then just any other purpose that's not specifically identified in CFR. Next slide. Talk a little bit about completing an application, registering. SAM.gov, really important here. If you haven't started this, please make a sticky note, put it on your forehead, put it on a friend's forehead, whatever you got to do. Make a sticky note to get this process started, because this can take some time. So you need to have an active registration in SAM.gov prior to registering in grants.gov, where grants.gov is where you're going to put your application materials. This can take 12 to 15 business days to get your SAM registration. It needs to be active. So please, if you haven't started that, get that started now. The entity name that you put in SAM needs to be your legal name. If you're doing business as, you have the option to also include that information. It has to remain active with your current information not only while we're considering your application, but also for the life of the award. If you're granted the award, your SAM registration has to be active. And there are like annual renewals to keep in mind. So please make sure you're staying on top of the annual renewals also. Important to note here, your financial assistance representations and certifications need to be made. If these were not made, you can go ahead and do it. Important to do it before you apply. So please go into sam.gov. The next slide, I think, is going to show us a little bit about how to do that. Well, a slide that's following after this, sorry. All right, sam.gov registration. A little bit about the certifications here. You're going to be asked, do you wish to apply for a federal financial assistance project or program? The system defaults to no. Basically, we need you to go in there, make sure it's correct, of course, and mark yes on those. So next slide should show us. Okay, this is what you'll see when you go into the system. The giant yellow arrow is pointing to the default of no. So read that and confirm that you want to answer yes on that. We need to have yes on that, actually, if you want to be awarded. So important to keep in mind. Next slide, please. A little more detail. In sam.gov, you'll have a UEI, which is Unique Entity Identifier. That is required in order to submit an application. It's free of charge when you register in sam.gov. In fact, if you're already registered in sam.gov, you already have a UEI. But the UEI must be for the applicant, not one of your affiliates or subsidiaries or your parent company. It's for the entity that's applying. And this will be used to submit an application in grants.gov. You'll need another piece that you're going to need is that login.gov account. So just you'll need to have an email to register. Grants.gov is where you're going to tie it all together. You're going to have an email address, phone number, your organization name, your UEI, login.gov account, and this will be used to create your grants.gov application account. And you will create a username and password, link your grants.gov account with your login.gov account. So a few accounts there, but basically the bottom line is just get started early on these. Follow this step by step and make sure that you don't miss the boat on these on the windows, because it can take some time again for the information to flow from sam.gov, and also it takes like a day for some updates in grants.gov to process. So next slide. We'll talk a little bit about components of a complete application. I'm not going to read each of these. We're going to go into detail here on each of these, in fact. But here is a list of everything basically that you're going to need for your application. Please refer back to that. These are all also kind of further explained in the application guide to assist you in the process. Next slide. We also did create some sample worksheets to assist you as you are doing your application. There's a worksheet on your project sites. We'll talk about that. Your rurality calculation, economic need, your match, and your budget. So there's a sample worksheet for each of these, and that's on the To Apply tab of the DLT website. Okay, attachments. So the important thing here is when you get into grants.gov and you're uploading basically your application materials, you're going to do that in grants.gov. That's where we receive your application materials. And the important thing here is that you need to use the SF424 block 15 button, add attachments. Okay, only use this add attachments on your block 15 to attach documents. Don't use Don't be tricked by the Adobe Reader attachment functionality. Only use the SF424 block 15 button to upload your attachments. You don't need to put them all into a single file. You can separate them out. You can have as multiple attachments. It doesn't, the system takes lots of different file formats, and it doesn't matter what order you upload them in. So just again, make sure you're using that block 15 add attachments button. Okay, next slide. We'll talk a little bit about project sites.
These are some important terms to talk about how we define the project sites. A hub site is a facility which is part of the network, and that's where the folks who are the students in a distance learning project or the patients in a telehealth project are receiving that. So you have a couple of types here. You have a pure hub that receives no end user benefits. I'm sorry, excuse me, they provide it. They don't receive it, the other way around, they provide it. So this is going to be where you've got the folks that are providing. So again, you've got a pure hub that receives no end user benefits, and you may also have a hub / end user site where there's a combination. You're going to want to detail that. In an end user site, this is where the network or telecommunication system utilized by the end user. So this is where your patients or your students are located. We comment here again, talking about the hub end user site combined. So this is one that provides both functions. And then a non-fixed end user site, if the equipment funded by the grant is going to be used by the rural residents in their home or in a mobile facility, the project will be deemed non-fixed. We talk about that in the application guide some as well. If you have the time and you talk to your general field representative or your state office, and you think that you need to have a discussion about where these facilities are located, which term applies to each of the facilities, this is really something that we discuss commonly, so it'd be great for you to bring up. Obviously, we also hear some hybrid projects, and so again, good points for discussion with your GFR. Next slide, please. All right, so project sites. Again, we're going to be asking a lot of questions in the application where you will have to detail what these sites are about, what's going on at those sites, which term applies to those sites. So you're going to need to include a number of things. So the description of the participating hubs, the end users, and the number of hub end user sites, the number of rural residents to be served by the project. We know that you can't do an exact head count, so make the best number you can, obviously. Then the location for each of them, for each end user and hub end user site. We ask for congressional district, city, town, village, borough, or rural area and the state. This worksheet's actually on the website under the To Apply tab. I would encourage you to go pull that down and work with it as you are laying this information out, so that when you get down to time to put it all into the chart, you're not missing something later on down the line. The DLT map that we have on the website will help you with your congressional districts, so you can use that there as well. The last note there, listing all locations to receive grant funded or equipment or will function as a central piece of the proposed project. So when you get done, you should be able to look at this list and say, every site involved is detailed. And there is more guidance about how to deal with non-fixed end user sites in the application guide. Next slide, please. Let's talk about an executive summary. Next slide. Executive summary is going to provide the reviewers, that's the RUS staff, who are going to be looking at your application with the first overall view of the proposed project. A lot of things that are going to go in here are going to be very important when we start talking about the scoring, because there are two sections of scoring this round that are purely objective, data driven. But then there is a third section where we are going to look at the need for the project, and your executive summary is going to help with that. So why is the project needed and how the applicant will address those needs? You're going to describe the applicant, that's you, including documentation of eligibility, proving that you meet the eligibility that's noted in the regulation. Explanation of the total project cost and a breakdown of the grant and matching contributions. This portion is where you put words to the numbers. So the budget worksheet is going to have the numbers. The executive summary is going to be you detailing those numbers. A statement specifying if the project is primarily distance learning or telemedicine. If it's a hybrid project, you do need to say which one it predominantly is. We know that some folks may say, well, it's kind of 50-50. Well, we need you to make it 51-49 and tell us which one leans more towards. We do support and have seen a number of hybrid projects over the past, but because of how we track things, it needs to be one or the other as the predominant. And then a statement of whether or not the project is proposing to reduce substance use disorder, including opioid misuse in rural areas. That's a regulation requirement to also be in your executive summary. Next slide. At the end of the executive summary, we want you to include a publicly releasable project description. It's going to include 5 things that we've listed there. If you go into the application guide on page 14, it has some examples. This is something read by the world if you are selected. It is also, therefore, going to need to be something you give consideration to if you have proprietary information about your organization, your company. Don't put it in this. This is something that you would be just fine if you are a private business. Let's say it would be something just fine with your biggest competitor reading. That's what we're talking about here. It's for the world to see. Next slide. All right, let's talk about scoring. Next slide. The first section, up to 40 points, rurality scoring. We're going to be using the 2020 decennial census. And we've got a link here for you. By the way, slides get posted to the program website under the To Apply tab. The previous webinar already has the slides up there. And sometime today or tomorrow, we should have the link to the actual video, the recording. We post it to the USDA YouTube page that we have our recordings on. You'll see that later today as well. It's there. Going to use your sample rurality. You see the sample rurality calculation worksheet there. Those worksheets, again, are on the website. We will be calculating rurality. As you see here, we will be omitting military-based populations up to 1,500, incarcerated populations up to 1,500, so that we can comply with a few requirements we have and get a true picture of your rural population. A link to the DLT map is also under the DLT website's To Apply tab, and it's here as well. The more rural you are, the more points you get. That's how this one works. Next slide. There it is. That's the scale. As you see there, there's a 40, a 30, a 20, and a 0 option. Non-fixed in-user site projects will have a rurality that is determined by their hub locations. And additional guidance is in the guide. Next slide. Economic need scoring, also totally objective. These first 2 are simply data. We're going to be talking about economic need. We're going to be using the SAPE data score that is applied to at the county level for where your project is located. The SAPE data is actually on the program's website. If you go to the To Apply tab, it downloads as an Excel spreadsheet. You're going to look in column H, as in hotel. Column H will have the total SAPE score that we're looking for. You will find your county, and I will warn you, I was actually helping someone today and we were looking for a county. It was a more common name than I thought it was. So make sure you get the right state and county, and then the score that's in column H for that particular county. Next slide. So here's what we have here. Total project economic need score. And if it's one of those areas that does not have a score, if you can't find a score in the SAPE data spreadsheet, it's going to get 30 points. If you have any issues reading that Excel spreadsheet, you can always send us a contact us case, and we'd be happy to help you get through it. Next slide. Needs and benefits scoring. This is where we start talking about subjective scoring. This is the one and only section that is subjective scoring. We're going to measure the extent to which the proposed project meets the needs for distance learning or telemedicine services in the rural area that you're talking about serving. In this, you want to state the economic, educational, or healthcare challenges facing a project's respective communities. Provide any documentation that supports it. You're going to want to substantiate and quantify the challenges with verifiable data and statistics. Putting a link or a reference note to where the data came from is a great way to prove that you have verifiable data that can be used. So if you think about it like you're writing an academically based paper in college, address why the applicant cannot afford the project without a grant. Document support for the project provided by professionals in the educational or healthcare fields. Documenting support can be that you include letters. Any economic data used in this section should not be duplicative of the data used for the economic needs scoring criterion because we already have it there. So find new data that supports what you're talking about here. Next slide. We're also going to talk about evaluating the benefits that are derived from the services that you propose in your project. So in your application, you need to document the specific benefits of the project and quantify them in terms of expected outcomes. You want to tie the benefits of the project directly to the stated needs the project is intended to address and provide measurable targets or goals. We have a nice little example here. For the distance learning project, for example, that serves secondary schools, you might be able to provide the number of schools and students that will benefit. You could contact the superintendent's office and say, how many of these types of schools will I be serving? What is the population of students there? They have those numbers. They are exact numbers that can be proven if we need to go back and check them. Next slide. Number 3, we're going to address the local community involvement in planning, implementing, and financial assistance for the project. You should include evidence of participation in the project, such as community meetings, public forums, and surveys. You can include those in the application. Documentation of the willingness of local end users or community-based organizations to contribute to the cost of completing, operating, or maintaining the project is a strong indication. So this can include letters of financial and non-financial commitment towards the project from local organizations. People ask, what is non-financial commitment? That might be that the approved types of in-kind donation are going to be given. That might be that you are going to have a nonprofit that agrees to promote across their social media platforms, their websites, their publications, etc., that you are going to have this project up and going. Next slide. Let's talk about matching. Matching obviously is something that gets discussed a lot by a lot of folks as they look at the 15% match requirement. That is a minimum. So if you are a project that wants to offer more than 15%, you can, but yes, it's a 15% minimum. Cash or in kind. Let's talk about this. Cash obviously is the easiest one to calculate. Dollar for dollar goes, we figure out the 15%. For in kind, only new non-depreciated equipment with an established value may be considered as an in-kind match. Vendor discounts or supplied equipment is not necessarily, and it isn't itself is not an eligible match because vendor discounts themselves cannot be truly calculated to value. When you say 10% off, well, 10% of what? We don't know. Future revenue is also not an eligible match. Future revenue fluctuates too wildly for us to be able to guarantee that as an objective marker. It has to be for the purpose that would otherwise be eligible. So let's say you're going to have an in-kind. It would need to be a piece of equipment that A, the program itself could fund, and B, would match to your specific project. If you're an American Samoa, Guam, the Virgin Islands, or Northern Marianas Islands, you are exempt from this. And any kind of in-kind line item that is for an ineligible purpose, therefore impacts the application, meaning that the line item itself cannot be budgeted for the match. So we would take that out of the match, recalculate your match, and it could potentially fall below 15%. Next slide. Federal funds, generally speaking, and I'm going to talk about a specific example of an exception to this, but generally speaking, federal funds are not eligible to be a match unless specifically authorized otherwise by federal statute. The onus of proving that the federal statute allows is on you as the applicant. The application has to include that documentation of the statutory exception with the application for the federal match. We do know, and here's the exception we know of. If a project's in a county that is an eligible county for the Appalachian Regional Commission, the ARC, We know that those funds can be used as a matching contribution. If you're going to check those counties, you need to go to the Appalachian Regional Commission and view their map to see if it's a respective county that is eligible. Their counties cover multiple states, so check their maps. To document a match using a non-federal grant, such as matching funds, you need to include a copy of the announcement letter from the grantor. The letter must be explicit about the purpose of the grant and not have limitations or exclusions. Essentially, it has to be an unrestricted source of funding to come to you. And the funds must be available at the time of application submission. Next slide. Scope of work. Next slide. The scope of work is provided through a narrative that explains how the goals of the project will be completed. This is a very important one because if it's not complete, we don't really know what your project's about. And so your application will be deemed ineligible. There are some minimums that we have listed here that you should include, such as specific activities to be performed, who carries out those activities, the time frame, and a line item budget for your capital expenditures. The application guide has additional details for this. Next slide. Let's talk about financial information and sustainability. Next slide. All right. The narrative here, when you talk about demonstrating project feasibility, is to discuss how the project will be sustained following its completion. There's a 3-year period of performance that goes with this program. You need to be able to talk about how this will carry through the 3 years and, if necessary, beyond. We want to know that this isn't just a flash in the pan. This is something that's going to be there for rural America in the long term. Demonstrate the sufficient resources and expertise to undertake and complete the project. Demonstrate how funds and institutional financial support sustain the project and maintain the continuity of service. You should include all your assumptions and detail what those are about. Describe a project's expenses in the project budget. Again, words to the numbers so that we understand them, what it really means. Contain evidence of cost-sharing arrangements among hub and end-user sites, if applicable. And identify any other items that may affect feasibility or sustainability of the project. You should tell us what future dangers could face this project, if you know what they are. If you don't know, okay. Next slide. Statement of experience. Next slide. This is 3 single-space pages. Describe the organization's capability and experience operating an educational or healthcare endeavor or project similar to the proposed project. Pretty simple. Experience working on similar projects is desirable, but it's not required. And if the applicant does not have experience with projects similar to the proposed project, discuss how the applicant will overcome a lack of experience. I know that this gets asked a lot because some of our other programs require big backgrounds of experience. You just saw me go through, or you just heard me go through that section right there at the end. If you don't have it, you need to discuss how the applicant will overcome a lack of experience. If you're planning in the future, hey, if we get this grant and we start this project, we're going to add staff separately. That's a way to do it, for example. Next slide. Telecommunications systems plan. Next slide. You should review the DLT regulation. By the way, a link to the regulation is on the main landing page. If you go to the DLT program page, just scroll down towards the bottom. It asks what regulation or what is the governing source for this program. That's the regulations link there. It's going to have components of the TSP that you need to include, such as your system plan narrative and a system plan map or diagram. Failure to provide a thorough TSP may result in a rejected application. Next slide. Now, for the system plan narrative, you're going to describe the overall DLT network and use of the proposed equipment. You see where we talk about each end user and hub end user site. You're going to have to provide those details there. Discuss the applicant's relationship with participating sites and whether the application is being submitted as an informal consortium. Detail each line item in the scope of work budget by line item. So reference the line items. Provide justification of the equipment based on discussions with technical experts. We need to know that what funding would be going to, this equipment would actually be usable. That way we can continue to be good stewards of tax dollars. Discuss possible duplication of other DLT efforts and how the project avoids duplication. Duplication is a big no-no. So we need to make sure that we're not duplicating an effort that's already in the area, especially if it's receiving federal funds. See Schedule J4, which is noted in the application guide, by the way, for the non-duplication of services certificate. That will provide all the details you need to know about non-duplication. And then discuss the applicant's involvement in any previous or current DLT grants and applications. That gives us a bit of background on your experience with this. Next slide. The system plan or map diagram include a map drawing the spatial representation of the service area, display an overlay of the proposed distance learning and telemedicine system. Each site, hub end user, and hub end user sites must be represented on the map. That way we know everything's at relative to looking at it on a map. Next slide. Let's talk about other federal statutes that you'll need to be aware of. Next slide. There are 4 certifications that you're going to have to attest to. And I want to point to something very important here. Earlier, there was a slide that talked about the required items. Item O was that you have to include the checklist. The checklist isn't just a tool to help you. The checklist is a required item. You sign for it. And by signing for and including the checklist, you're also therefore signing and attesting to the 4 that you see here, the 4 certifications that are required to be adhered to under this program. It is under the To Apply tab. Informal consortium applications are a scenario where each entity must provide a set of the certifications. Again, those are in Appendix A of the application guide. If you haven't figured it out so far, the application guide is a wealth of information. Extremely important. Next slide. There you go. That's a picture of what you'll see when you get to the checklist, and the signature block down at the bottom. It includes you acknowledging J1, J2, J3, and J4. Section J is the compliance with other federal statutes and regulations. Next. Let's talk about legal existence proof and authority to contract with the federal government. Next. So legal existence, you have to be able to provide acceptable evidence of legal existence. If you go into the regulation, point 4A is where you talk about the types of entities that are allowed to apply. That section is down just below the definitions. I know that because it's a common question, so I would encourage you to make sure that you're applying, you're complying with that. Corporations and LLCs must provide evidence of good standing in accordance with the laws of a state or another body under which they're organized. Entities exist under law, such as school districts, hospital districts, state universities, should provide a copy of the statute. So you'll need to go get a copy of the statute, potentially online, to include a resolution or other documentation that confirms the legal name of the authority is also an option there. If applying as a consortium, all members must be legally established with authority to contract with RUS. 2 takeaways here. One is a specific type of PLLC. A PLLC is a type of LLC. It's just a professional one. Legally, that means that the people in that entity in that type of LLC are required by state law to have a license, i.e. doctors. So a medical office that is providing healthcare to a rural area through a telehealth project would potentially, if they're organized this way, potentially be a PLLC, but they would be eligible. And then we commonly get asked about colleges and universities. Yes, colleges and universities are eligible because they are a sub-element of government if public, and then they are potentially a for-profit or nonprofit entity otherwise. Your SAM registration, you'll need to have a copy of your organization's SAM registration demonstrating that the financial assistance representations and certifications have been made, and that shows it was active before the date of application submission. You'll also include the entity name, UEI, and SAM specifically of the applicant. Next. Let's talk about environmental impact and historic preservation. Next. We have made great strides in recent months across all of government to streamline the environmental review, what is commonly referred to by its acronym NEPA. The April 2026 Final rule that implemented that effort on the National Environmental Policy Act, NEPA, and USDA has worked to update its environmental review processes. Our team's been hard at work here. I can tell you that for fact. The FY2026 application guide does contain instructions for compliance. It's in section J as well as in section L, and you should review those carefully to ensure you have alignment with the new regulatory reforms. If you do have questions, feel free to send us a contact us case. Applicants must provide details for the proposed project's impact on the environment and historical properties. There are 3 things there you need to include if there is going to be an impact. And you may provide any additional environmental review documents that have been prepared in connection with obtaining your permits, approvals, or other financing for the proposed project from state, local, and other federal agencies. So if you have something from a SHPO or a TIPO that talks about this, that would be good evidence to include. Next slide. Consultation with USDA State Director. Next slide. The applicant must consult with the USDA State Director for Rural Development to provide evidence of the consultation as part of the application. And you need to discuss the availability for other sources of funding at the state or local level. To assist the State Director in making an informed determination, you should provide your executive summary and the proposed grant and match amounts. You can contact them, and we actually recommend you do this as soon as possible. You can contact them at any point before you submit, obviously, so that you can include evidence of your submission, or your evidence of your meeting, but you should do it as early as possible because our state directors are very busy. They oversee all the RD state programs, which in turn are overseen by the undersecretary. There are a few states that share an RD state director. For example, Massachusetts, Rhode Island, Connecticut share. Also, Delaware, Maryland share. So Vermont, New Hampshire share. So if you're not sure where to find them, feel free to use that link right there. That's where the current listing is at, and it includes the contact information for all of them. Next slide, please. Application submission. Next slide. All right, so you have a number of available resources. You have the application guide, application checklist, sample DLT worksheets, sample tribal government resolution of consent, and other items that can be found under the To Apply tab of the DLT website. When you land on the website, you'll see a gray box. Look below the gray box, you'll see a couple of tabs. One of them is the To Apply tab. The To Apply tab seriously has every tool you'll need, all the worksheets, the guides, et cetera, et cetera. It's where PowerPoint slides are put. It's where I'm going to put the link for the recording later today. So it's just an amazing resource page. We construct those websites purposefully. Our web team here at Rural Development really helps us to ensure that useful information is just packed into those. Next slide. The application checklist, there's a picture of it. It's on the website. Next slide. All right, submission. If you haven't been taking notes, here's where you should definitely take notes because we get asked this a lot. Application submission deadline is June the 30th, 2026. The cutoff time is 11:59 p.m. Eastern Standard Time. You do it through grants.gov. When you add your attachments to the form, you use block 15. The date and time is in the gray box at the top of the DLT website page. And so if you, the main page, so if you forget this, you can go look there. SAM.gov registration with financial assistance, representations, and certification must be completed before the application submission. So it's got to be active. It's got to be there. So before you submit. Next page. All right, a lot of resources. Keep going. We have our website, profound tool to use. We have our GFRs. Cannot say enough great stuff about our team out in the field. General field representatives cover one or more states. The link there will guide you to find yours. And then the Contact Us help desk. That's quite literally where you will submit inquiries. We do ask that you use the distance learning and telemedicine program option. There's a drop-down menu. Pick distance learning telemedicine program and submit your technical questions and request assistance from RUS. Our team right here, literally myself, Doug, a few other people that are on the call here, we are the ones who answer those. These are not I don't know. It's not a lot of things. It's literally RUS staff who manage the program giving you direct answers. And I will also tell you that sometimes a direct answer to the contact us case is that we need more details and we need to discuss your project in depth. That is something we're going to encourage you to discuss with your GFR. We do not want to publicize anything that's proprietary. And we also don't necessarily want to waste your time in a back and forth email chain. So if we say to you, hey, there's a lot of details here we're going to need to know before we can answer your question, please contact your GFR. Please know that we're trying to give you the best answer so we can give you the depth of answer that your question deserves. Next slide. All right, question and answer. Doug, you back with me?
I am here.
All
right,
right.
let's launch into some Q&A. We have had a lot of questions come in. We're trying to get to a lot of those. Let's take a look at some of the ones that we haven't gotten to yet. And as Ken mentioned, if we're not able to get to all of your questions here in the 10 minutes or so that we have left, go ahead and use that contact us help desk. All right, let's go to a question here. Are public libraries eligible? And so, so one of the eligible entities, I can go ahead and take that one. If it's owned by a local government, if it's a unit of state or local government, yes, it could potentially be eligible. So you'd want to get confirmation on that. But yes, that is a potential eligibility for like a hub or end user location. Okay. All right. Some other questions. And we will be, yes, lots of questions on are we posting the website, the slides? Yes, we will post the slides to the website. There are already slides posted for May 20th's webinar if you want to take a look at that. But yes, we'll get this recording up as well. All right, another question. Due to recruitment and retention of providers in our rural clinic, we are hoping to use that site as an end user site that allows for providers from the less rural site to provide telemedicine to patients. Is that an eligible use of the DLT fund? So anyone feel free to jump in here, or I can recap my understanding of this question. So hoping to use providers from a less rural site to provide telemedicine to patients.
Hey, Doug. Yeah, this is kind of, yes. And we see a lot of this where we actually have, hub end user sites with a couple different clinics where there's a specialty in one clinic in a rural area and not another. And so you can actually have 3 or 4 sites that are all rural clinics that operate both as hub and end users to be able to share specialties amongst different clinics without the doctor or the specialist having to drive from one to another. So this is perfectly eligible, especially since it's in a rural area already. But we see this quite a bit with clinics and with schools where they have, say, a German teacher in one school and a French teacher in another school, or a math teacher in one school, and they share resources amongst themselves in rural areas. And this is a really cool example of how rural communities are partnering to kind of share expertise.
Excellent. Thank you, Shekinah. Okay, we do have a question. Is NEPA review required for all applications?
I'll take that one, Doug.
Okay.
So generally speaking, per federal law, we do look at every application, but that doesn't mean that every application goes through a Section 108 review, which some of you may be aware, that's the really in-depth type of review. So what we do is we're going to rely on the information that you provide in your executive summary, in the environmental information that you provide. And we're also going to talk to our team on the ground as the general field representatives. And if we need to go more into the weeds on one particular environmental review for a project, we will. But technically, high level, the answer is yes. It just doesn't necessarily mean everybody gets an in-depth review.
Thank you, Ken. All right, we have another question here. Indirect costs, are these eligible expenses?
Hard no. Hard no. We do not fund indirect costs under this program. So the costs are going to be about you delivering with the equipment that's purchased. And so be prepared for, and I'll give you an example. If you're using a location and you're responsible for the light bill, you're still responsible for the light bill. So we're talking about the cost of you getting this project up and going for the equipment, and potentially because some of the technical expertise to get equipment up and going, that's talked about in the guide and the regulations. So those things there. I would encourage you to go back to the approved, what's called eligible expenses, and the ineligible expenses sections of the regulation and slides and application guide.
Yeah, and can I expand on this just a little bit? Because I think there's some confusion. We don't even fund all direct costs. So just because something is necessary for the project doesn't mean it's necessarily eligible. What is eligible under the program is those things that actually facilitate the connection between a provider and a recipient. So that's a doctor and a patient, a teacher and a student, those kind of things. So like scheduling software, that may be required to be purchased so that you can schedule over these distances with both people, but it actually doesn't facilitate that connection. So it wouldn't be eligible. We've also seen some things that are eligible or that are, required for the doctor to use in one location or a nurse to use in one location. But if it doesn't actually connect back to the doctor or facilitate that connection, it may be required for the project to be successful, but it wouldn't be an eligible cost of the program. Our program funds the equipment, software, programs to facilitate that connection.
Excellent. Thank you so much. Okay, the next question we'll take, this is around vendor participation in the application process. So if a technology vendor provides equipment quotes, assists with the system design, and helps us prepare the technical portions of the system plan, but we write and submit the application narrative, would the vendor remain eligible to provide equipment and services under the project if funded?
So Doug, I'm going to take this one. It should kind of, I'm going to bounce this off of you, but the way that I read the question, and that's the key thing here, the way that I read the question, it says assists with the system design. That is where you start to see that the vendor could have a conflict of interest, because they could say, we're going to design a system that only uses our proprietary equipment. That's something we're going to look at very hard, because 2 CFR 200, which is the regulation that talks about the use of federal funds, like for grants, talks about how vendors can be chosen. And so if you have a question that's more in detail, you can send us a request. You can reach out to your GFR. But just as I read it right here, I would have a lot of questions about why you need that one particular vendor to help with that.
Yes, and that's correct, Ken. There's also some things, certain states have certain procurement procedures that they've already gone through. So if your state has already said, hey, we've gone through a procurement process and these are the vendors you can use, and you're using one of those vendors to help with that, then that may qualify. So it's one of those things that there's a lot of nuance to some of this when it comes to the vendors and their ability in there. But what we're looking for is if you've already gone through a procurement process based upon your state rules as maybe a higher institution or a school district, then there may be a little bit more flexibility in that, because there's already been that procurement process that's been completed according with other rules, which 2 CFR does allow. But if you're just going out there and trying to figure this out and they're giving you a complete solution, then there's some issues with competition. There's also some other things in there that we have to consider of, are they a sole provider? They're the only one that provides a specific type of equipment that does, we've seen this with some of the AI and some of the augmented reality stuff, that there's really only one person that provides this technology. And if you can show the research that says, hey, listen, they are really the only people to do this role or to have this type of training that we're looking to do, so they've helped us build this, then we can say, okay, yes, this makes sense. But it's not necessarily going to completely disqualify you on the front side, but we may on the back side say, hey, you need to go out and do this research or provide this additional information to validate that this is still eligible for you to use that vendor. And one of the things always that you can do afterwards, if you have a vendor kind of help you put stuff together, is you can always redesign and come back in for scope changes, as long as it doesn't substantially change the scoring criteria. You're not changing end user sites, those kind of things. If you want to kind of switch up kind of what the delivery and equipment is, that's something that we can work with you on the backside if you're awarded.
Great, thank you. We do have another question here. So if we are unable to have a consultation with the state director, we cannot submit a complete application?
No, that's not necessarily true. So I would offer two things here. Number one, if you've been sending emails to that state office, that state director, trying to get a hold of them, that is evidence of your good faith attempt. Number two, you can reach out to a GFR and ask for assistance. And I'll even go so far as to say, we're here at the national office. We have connection to these state offices as well. And maybe you're reaching out to the wrong email, wrong phone number. So you can send an inquiry. I'll be glad to take the inquiry. It's what we do here all day. We help people get through applications. So if you got a problem, feel free to reach out to us. But otherwise, if you're really coming up on deadline, just include all the emails that and all the paper trail that shows a good faith effort, and we'll move forward with your application.
And I'll add one last thing into that, Ken. If you make no attempt to consult with the state director, that is a requirement for a completed application. No attempt at all is basically, and you're still submitting that application, gives us pause when we're reviewing that application itself for completeness.
Yes, two sides to every coin.
All right.
So here's one here, and we'll take this one and we'll make this one the last one. It says, if we're applying for this grant for a new facility and are still working to obtain licenses, permits, etc., to operate the facility, are we eligible to apply, or these must be in hand at time of application? They have to be in hand. You have to be an entity that's legally allowed to operate said project. So if you are doing a telehealth project and you don't have the doctor yet to deliver it, if you don't have an occupancy license, you're not legally allowed to operate. Those are the types of things we're looking at. So yes, you have to be legally allowed to operate this award, this type of project at the time you apply. And with that, we will direct you to the Contact Us help desk. Please submit any inquiries you have there. Please pay attention to the website. We'll be updating more tools, but the things you absolutely need to apply are already there. We thank you for your time today, and this concludes our presentation.